Everyone. I see the numbers going up and up. Thanks for coming. We're going to keep this one short and sweet. I wanted everybody to have the opportunity to jump on early, and we're going to get started early as well. I don't know if you can see on your screen yet, but I do have Dr. Todd Alpert here. He is a 19 graduate from UC San Francisco. Go ahead and say hi, Doc.
Hi, everyone.
Let me go ahead and I'm going to put this up. And we'll be getting started shortly. Just give me one moment. Hopefully everybody sees this. This is a perfect time to start throwing some questions on the chat. See the chat box, please feel free. I do apologize. I am not currently in my normal environment when it comes to my multiple computer screens. I'm going to be working on a single one. That is not my artwork. That is artwork from a beautiful hotel. And everybody should know that I'm currently in San Francisco waiting to see you all at the taco truck that we're going to be sending up on Wednesday. So just so that everybody is aware of where the heck I am. Where are you, Dr. Alpert?
I'm just home. I live out in
home.
Yeah. It's
and
like
where's home for everybody?
I was gonna say it's 20 minutes east of Portland.
Awesome.
Yeah.
Awesome. And what's that city called for everybody that happens to be from Portland or from Oregon?
Yeah, it's weird. It's called Gresham. It's kind of on the outskirts of it. So it's right where the city like transitions to like a lot more rural.
Nice, nice. Well, and we'll have a conversation about some of the patients. Hopefully we'll have conversations about some of the patients you see. I do have my phone filled with some of the questions that a lot of you are sending through. Uh-oh. Am I supposed to hear anything? That's Teresa. Yeah, we're just talking, Teresa. If you can hear us, I'm not quite sure by that. You can always send me a text message again. Let's go ahead and we'll give everybody maybe a couple more minutes. For everybody that's just hearing us randomly chat, we're going to be getting started shortly. Welcome. And for all those that haven't heard, I have Dr. Todd Alpert. He's a 19 graduate from your school, and he's going to be talking about his experiences with the program, with the UCSF program, final year especially, and his experiences working for Aspen Dental. We will give it a couple more minutes. And in the meantime, for everybody that is joining, hi, welcome. My name is Derek, for all you that haven't met me. And I'm going to talk about this CE opportunity. Since we're going to keep this probably to about 35, 40 minutes because Dr. Alpert has to start prepping for tomorrow, and I have an event following this in San Francisco as well. We'll make this short and sweet, and we're going to offer an opportunity for everybody that is interested in wanting to learn more. I will be here in San Francisco at your school tomorrow around lunchtime. If you're available to meet during that time, we can coordinate an opportunity for you to come and have some lunch on Aspen Dental. And then Wednesday, it'll be the taco truck. Most importantly, though, we are offering a free CE opportunity for everybody that has any questions about this. You can always message me as well a little bit later once I send you the thank you email. This is a free CE opportunity, not only to all Aspen dentists, but also we're extending our availability to students. So you'll have the ability to go check it out. Go to aspendentalce.com/welcome, and you'll have full access to our catalog of CE for absolutely free. Again, aspendentalce.com/welcome. And most importantly, speaking of welcome, I want to welcome the person of the hour. This is Dr. Todd Alpert. It looks like we got some good people, large amount of people on. So tell us a little bit about yourself, Doc.
Yeah, so I graduated in 2019, and then I decided I wanted to go into general dentistry. And I was kind of willing to go wherever the job was right. So I moved in with Aspen. It was in California at the moment. So I got placed in like Klamath Falls, did that for a year, got really good at it. and then decided, that I wanted to be closer to a city, asked the company, get me closer to a city, and then got located out here. So I love doing general dentistry, meaning I kind of like a little bit of everything, with a few exceptions. Um, but yeah, I feel like, I don't know what else.
Where'd you go? Where were you born and raised? Where
Oh,
undergrad? Do you have any hobbies?
I don't know. So I mean, I'm from Southern California, and then of course I was like in Northern California for school. I don't know. I feel like after work there's like not much to do. What do we do? I don't know. I just kind of like explore the city. I mean, I'm like new to this area too.
That's awesome. Well, welcome. Hopefully everybody can see you. We can't see them though. So chat between you and I. For all those that aren't familiar with who I am, my name is Derek Robinson. I'm a part of the business support side of Aspen Dental. As you can see, this is not my normal environment, so I taped one of our signs up in the corner of my hotel room. And so I work for a company called Aspen Dental Management Incorporated, which is a completely different entity than what Dr. Todd Alpert works for. And my main job, first of all, is to work specifically with the schools in order to get interested future dentists in front of doctors like Dr. Alpert to understand exactly the opportunities that are available. And we offer pretty much any particular way that we can, support our doctors, anything from marketing to support like inside the offices and so on and so on. So I want to start with a loaded question for you, Dr. Alpert. Since we do have the business support side, how do you feel supported by Aspen Dental Management?
Yeah, so I mean that's a good question, because I feel like as a new grad, you come out and you're like, I'm super scared. Like, who's gonna help me through this? I know that was like my first thought. So, every company says they're gonna support you, and you just never really know what that means. But it turns out that in Aspen, there's like a whole team that's dedicated just for like new doctors, and then after that, you get like a different team, kind of like once you transition to becoming not a new doctor anymore. So like initially you have, you get assigned a mentor. They're there to, support you through how to basically just do everything from meeting patients to actually doing treatments in timely manner. And if you have questions, they're there. Basically, there's always someone you can call. If ever there was like trouble in the office and I was by myself that day, I could just call like a head dentist and then be like, oh, have you tried this? Or there's an implant specialist. So if I have trouble with implants, I call them. They answer right away, believe it or not. If I have general administration questions, there's someone assigned to just general administration questions. So like a staff member that's not cooperating, there's a whole team just for that. So there's like all of that. There's like all these teams that support you with that. And then there's like all these other teams that are like there to support you further your education. So, if you want to go into implants, then there's like a whole implant team that, you train with. I don't know, and then there's like other dentists nearby. There's like a head dentist. So I feel like the support thing, there's all these different avenues. You end up not using a lot of them as you get better and better, to be honest with you. You end up needing less and less support. But in the beginning, it's nice. You have like 20 different people that you can ask for help.
You heard it, folks. We're not just, saying that for the sake of saying it in front of you. I mean, especially as fourth year students, there's a lot of stuff that's ahead of you, especially when it comes to learning clinically that's outside of your clinic, right? Dr. Alpert, why don't you give us real quickly before we get to the Q&A, and by the way, you can continue to type in questions on the Q&A button. I've already received a few, but what was your experience as far as your fourth year and then going into like your first couple days of working with the company?
Yeah, I mean, so in fourth year, you have like some experience. You've done a little tiny amount of every single thing. And I think you're not going to be very good, to be honest with you. I always knew that. Like, I was like, we just barely had like these really simple procedures. We get to take unlimited amounts of time. And I was like, there's no way this is going to be what it's like in the real world. So I'm like, I feel like if you're not terrified, like that's kind of odd, because it is a terrifying thing to think that you're going to go from seeing 2 people a day to seeing 30 to 40 people a day. Because it sounds like, how's that even possible? Until you realize, once you get out there, you're like, well, there's a whole team that supports you, right? You have 3 dental assistants just to help you. You have 3 front desk assigned to help you schedule. And then you have a lab technician designed to help you. It's just all these different things. And then before you know it, patients that you thought would take you an hour end up taking 5 minutes, or, you know, just these really short amounts of time. And so, I mean, that was just super different. Just have to think about it. You're going from working on your own to working with like a group of 10 people supporting you. And it's such a different thing.
Yeah. Well, thanks for answering the first question. We'll just cover it. And obviously I can put that we're answering this live. It says, thank you for speaking with us today, doctor. One question I have is, how many people work inside the average office? So let's do a real quick recap. And then if you don't mind too, talking about kind of continuity of care, the whole like working by yourself versus working with others, and how that kind of the goals and all that kind of stuff works out.
Yeah.
How many people are in the office? I'll do the count out just so that you got it.
So there's a front desk, there's a treatment plan coordinator, there's an office manager, then you have 3 dental assistants, and then you have a lab technician, and then usually there's 2 hygienists.
Okay.
And then there's yourself.
Yeah, and then there's you, and then any other doctors that are associated.
Yeah.
So, you know, what I'd like to add on to this, and feel free to jump into, the beautiful part about our offices is that we don't have a cookie cutter shape to these offices. It depends on your location. It depends on how busy the offices are. And more often than not, everything that you heard Dr. Alpert talk about is all included in there. It might just be different. It might differentiate between one and multiple people. And then also as well, can you talk about specialty and all that kind of stuff?
Yeah, so remember when I said there's like, with an exception of things I don't do? So one of them is root canals. I like refuse to do root canals. So the specialist comes in once a month. She does all my root canals for me, and then I do all the crowns on it. Same thing with the oral surgeon. I don't touch patients that have had bisphosphonates. They want IV sedation. That's not me. That goes right into the oral surgeon's category. So those are your 2 main ones, because periodontist and oral surgeon can basically do anything they can do, so you don't need them. And then peds I just refer out, but if you feel comfortable, you're allowed to do it. It's just whatever's in your comfort zone. The big thing with the company is they don't want you doing things that you don't want to do or that you don't feel qualified to do, so they've never pushed me to do it.
Hold that thought. That just came in. I'm going to go ahead and press answer live. Hello, do you ever feel that treatment is being pushed on you or the patient to meet a certain financial goal? Let's keep talking about that.
Mm-hmm.
And then also talking about like the continuity of care and how all that kind of stuff works. So you don't feel pushed to hit certain goals or do certain procedures. Why is that?
So I always was expecting it, to be honest. So when I got there, I was like, oh, like, you know, I was trying to go faster. And actually corporate reached out to me, as in like Becky, who was the other like director.
The business support side, right?
Yeah. So she was like, hey, I noticed you're kind of going fast. She's like, you're new, like you really should slow it down, hone your skills, and the speed will come. And that's something I feel like people don't expect to hear. Like they told me to slow it down and that the speed will come. So, you know, she's like, when the speed comes and you're competent and you could do things well, that's when you start hitting your goals. And so ever since I followed that advice, I've never been bothered about hitting budgets or anything like that. They always ask me, you know, if I don't hit a budget, they're like, well, did you try your best? And I'm like, absolutely. And they're like, well, that's all we ask. And no one gets mad. It's totally different if you're doing something completely wrong. Like, you know, there's red flags that go up in treatment plans. You know, someone can look in there and be like, you missed all these things, but that means you're being like incompetent. And it's actually pretty difficult, I feel like, to be incompetent.
You talk about me? Let's clarify that, because I think the one thing that I want everybody to know, especially that's listening, is you are not pressured to do certain procedures. And the reason why that is because not only is it going to be you and maybe your mentor or whomever else is going to be in that office, especially if you don't feel ready to take everything on your own, but you are not pressured to do a certain procedure because you have office team goals versus individual goals. And explain a little bit about how that works. Like, for example, if you can't do a certain procedure and you have another support system, I know that might not be necessarily your case, but being able to give that to that person and that being a victory for the office. Can you explain a little bit about how kind of the teamwork goes in there?
Yeah, I was gonna say, because it's very team oriented. So the really nice thing about Aspen is, let's say, for example, they're like, we'd like you to make, let's just say, for example, $150,000 this month. They don't, if you're amazing at root canals and you could do a million root canals and reach it that way, then that's great. But if you need to partner up with the oral surgeon, they do their part, your hygienist is doing their part, and then you're doing, all these, maybe you love doing crowns, so you do more crowns than you do other procedures. In the end of the month, if that collectively comes together, which it does, if you like doing what you're doing, it will come together. You work together, and like also with your like lab technician, getting dentures, partials, you all come together to kind of, hit this budget. So it's
hygiene too, right?
Yes.
Yeah. So I mean, even something as small as selling a toothbrush at the front that contributes towards the goal. So to summarize for everybody, it's not an individual goal, so you'll never feel pressured. As long as it's about continuity of care, right? As long as somebody in that office is able to help and make that patient feel comfortable by keeping everything within, that is considered a victory for the office. Is that right?
Yeah.
Awesome. Okay, let's move to the next question. And I know there's probably going to be a million on top of that. So the reason why we're bringing these subjects up is so that you can write them all down. And then when we meet in person, you'll be able to ask us in person, because Dr. Alpert will be coming to some of our events, especially with some of the D4 socials. Next one. Hi, Dr. Alpert. Thanks for taking the time to speak with us. My question is, what did you find the most challenging in the first 90 days of working?
Oh, that's a good one, because so for me, the first 30 days were training, so it wasn't that challenging because you have someone that's your backup. So anytime anything goes wrong, I was like, hi, Dr. H, can you come get me out of this? So as long as you're okay asking for help, the first, month or two, depending on how long you want the training, which by the way, they offer 1 or 2 months, depending on how you feel comfortable. I decided on 1 month, but they didn't push me out. They asked me. Then after that, I started on my own, and it's a scary feeling knowing there's no backup. So I would say that was the hardest part, knowing you're in charge of everything and it all falls on you. So if something goes wrong, you have to figure out what the protocol is. Once you learn the protocol, though, I don't think anything's really scary. Like, no one's dying. If you can't get a root tip out and you have to write an OS referral, it's not the end of the world. But just dealing with all those situations for the first time, and if you're on your own, it's just a lot. But most of the time you start off as an associate anyway, so there's always someone there to teach you exactly what the protocol is for when procedures go wrong.
That's awesome.
Yeah.
Well, let's kind of stay on the challenges or what you find challenging. I got a very great question, and keep in mind, this is us being real. We are a very transparent company because we feel confident kind of in what we have to offer, especially to the patients and to the doctors. What is the one thing you wish you could change about the company or your clinic?
I'm trying to think. Well, not all of the
Don't
clinics
lie. Don't say,
I'll
it's perfect.
So not all of the clinics are like it depends on when they were built. Like, so some of them look older. I feel like that's like a fair thing to say. So not some of them are like really like high-end looking offices, and some of them aren't. So it'd be nice if they were all right, like the high-end looking offices.
Well, let me ask you this, because that's a great point that you brought up. What about technology, stuff that goes inside the office?
It's all really good. Yeah, they're very high tech, which I was actually surprised with. I felt like I was almost resisting, but like we do scanning. All the dental assistants are trained on how to do like, digital impressions for doing partials or just doing, even the crowns that are like implant supported. So
awesome. Let me clarify a couple of things. So first and foremost, I'm surprised that we didn't even go here. Every office is 100% operated by owner doctors. We, the business support side, does not have any influence in what Dr. Alpert does or what any of our other owner doctors or our associates or our lead doctors in the office, meaning that you have 100% decision-making ability of what happens in that office, depending on your comfort level or what you consider is the most important thing, as long as you keep the patients as the main focus, first and foremost. When it comes to, and because these owners are 100% making the decisions in that office, the owners and the partners have the decision of what to put in that office as well. Because we don't acquire any practices, we build every single practice from the ground up. Dr. Alpert has a say in any new technology or updating any sort of technology that wants to go in that office. Do you want to elaborate on that a little bit?
I was going to say, even with any instruments too, like if there's anything I want, I'm not very picky, but I know some dentists are. They're like, I want this specific instrument. You can go and you can order everything that you're looking for. Like you can order the type of bone grafts you want, the type of membrane. So all of that stuff, like you get to choose it. And I know I have friends in other offices where like you have what's in the office and that's that. So I always try to work with what's in the office. And then if there's certain things I do need, then I do order them. But I've never been told like, no, you can't have that.
And the reason why is because if any decision you make, you're thinking just like a manager or like an owner. Any you make on whatever you're going to get, it's going to affect your profit and loss statement, which is at the entire end of the month is what gets you paid or what doesn't. So it's just like running your own private practice, which I think is amazing. And to add on top of that, I hate talking, but I feel like this is so important too. Henry Schein is our distributor of supplies, any sort of machines. And we are the second largest provider of Henry Schein products behind the federal government. So we get everything at an incredibly discounted rate and we pass that on. And as an owner, one of the major benefits, especially if you want something super expensive like a CBCT, we're gonna sell it to you at a wholesale price, and then we're gonna cover half as a business support side, and that's the cost of going into business with you. So these are insanely discounted rates. And I know a lot of people, there's been a couple questions regarding like ownership, so we can definitely talk about that as well. Can you describe opportunities for promotion there's two questions on this. Okay. Can you describe opportunities for promotion or increase in salary throughout your few years at Aspen? And one question, if I start off as an associate, how quickly can I become the lead or the owner? So that's kind of a 2-1.
Yeah, I mean, those are
promoted and all that kind of good stuff.
I was gonna say, because those are questions like everyone has, right? Because everyone wants to move up. So, I mean, one of the things that's really important is there an opening? So I was looking, I was willing to move anywhere just to get my hands-on experience and then be able to be an MCD. Because when you first start off, some people do go straight into MCD. They just take a longer training before they start that position. So you'll be like at an office learning underneath someone. And then when you're finally ready, then you go run your office on your own. So some people go straight in. Other people take a whole year of doing an associate. So it really depends on you. So there's both. Typically, it's not more than a year. I feel like at a year, like you should be transitioning. Unless you really want to live where you're at and there's no openings, then you're kind of stuck waiting for an MCD to leave because there's only one per office. You don't need more than that. And then as far as becoming an owner, as long as someone doesn't already own it, you can pretty much buy it as soon as you're an MCD. The only thing is if someone does own it, which is like the case in mine, then you have to ask them if they're willing to partner. Why would they be willing to partner? It's because you're good at your job. So if you're not good, then that's when they're going to be like, well, actually, like we might want someone else to partner with. So that's why the big thing is the opportunities present themselves once you're good at your skill and are, doing a good job.
Holy cannoli. Okay, so there's a lot to recap there.
Yeah.
So, you jumped at an opportunity to become a lead doc right off the bat. And just so that everybody hears this, 9 times out of 10, especially as a fourth year, you start off as an associate. Well, Dr. Alpert started off as a lead doctor because he sacrificed a little bit of location versus wanting to be a doctor in the city, which we are not in, or in Beverly Hills or Newport Beach in Southern California, which we are not in, to go to an area and start working as hard as you can to learn as much as you can as soon as possible. Is that the understanding? Yeah. So second of all, every office is 100% owned and operated by the practicing doctors. We do not do any acquisitions of private practice. We build everything from the ground up. We have 950 offices. We're going to break 1,000 by the beginning of next year. Holy cannoli. And then we're at 8 offices in California, and we are growing and growing on the West Coast, which is amazing. So Dr. Alpert sacrificed a little bit of, the time in maybe an area that was less desirable when it comes to the city life in order to sacrifice to get a better opportunity. Great question. Did you want to add anything to that, Doc?
Oh no, I just consider like your first year out, like consider it like a really big learning period there. Because that's what I consider it. It's kind of like your residency. So if you're being really picky, you'll probably have less opportunities. But if you just are like, I just want to go somewhere where I'm going to learn a lot, like let the recruiter know, and that's what they'll find for you. Somewhere where you'll learn a lot. Your numbers will show, and then before you know it, people will start asking like, can I get that person to come over to my office? Are they trying to relocate? So I feel like it just works out.
Let's talk about that real quickly. So there's 42 people on here. My guess is that a lot of them are considering California. Well, having only 8 offices, and not only that, we have 6 now coming on to 7 dental schools that are going to be in California for those 8 opportunities, if any of them have an opportunity. That's incredibly competitive. So think about those types of things, and we can always have a conversation offline regarding that. And Dr. Alpert can also have a discussion with you if those are some things that you're really thinking about. Going somewhere else, kicking some butt, and then being able to come back at having a greater opportunity, whether it's a lead doctor or an ownership opportunity after that amount of time, in order to, get to where you want to be. That's a big sacrifice. It's kind of like going into a GPR, AEPD for those that are considering it, and then coming in and making some great money and having some great leadership while sacrificing just a little bit of time to do that. Real quickly, so what was kind of your process? You graduated in 19, you started with us, and then how did you get to where you are now?
Yeah, I was gonna say, because I feel like it just seems like it happened so easily, and it really wasn't. So I finished my 1-month training, and that was like, there was a mentor doctor I was assigned to. So that was out in like Springfield, Eugene, Oregon area. So once I finished there, I got located to the Klamath Falls one, and then the lead doctor was transitioning out. So he was there with me for like a week or so. Then he was gone, and then that whole schedule was mine. So I was like, okay, time to like really slow things down. So I basically just doubled all my times for my new patients, just overflow, like that extra column of where you can't really classify it, and then the production column. So I did that, and then after 1 month, I was like, okay, let's reevaluate, how much time do I need? Then I did that again the next month. And then it wasn't really until my 3rd month, I would say, that I was considered like profitable. Like I was actually running a schedule where I wasn't taking forever to do everything. And that's really where, now you can actually see more patients. You can do more things that you want to do. You know how to organize your schedule. But that took me 3 months just to get to that point where, where you basically are switching from like daily guarantee to above daily guarantee. So that was like a long process there. After that, once you start to see your potential, I feel like then you're even more motivated. You're like, oh, wow, like if I'm doing all this and I'm enjoying it and they're compensating me for it, like I could do even more. And before you know it, as long as you're doing stuff that you enjoy, it's pretty easy. Like I said, the money comes if you're doing what you want to do. And so then,
and what you're sorry to interrupt you, and yeah, you're doing that you think is best for the patient, right?
Exactly. Yeah, because everything that you present, it's assuming it's like the best thing for them, and then it's like, can they afford it? Usually or not. And then if they can, like, I'm like excited to do it. And then I want to say like 6 months in, that's when I was like really starting to peak a lot more, and that's when Aspen, I feel like, noticed, hey, like here's this doctor that's kind of like, he's coming up really quickly, he's hitting his goals. And then they would talk to me about, what are my aspirations, and they'll see like, hey, this person really wants to move in with the company, like really get, promoted, and they like the company, right? Because they don't want you to work for them if you don't want to work for them. And I always tell that to people, like, if you end up joining and you don't want to be there, like, you don't have to stay, like no one makes you stay.
Exactly. Yeah.
So yeah, then I feel like I got on the map, and then like the director was like, well, let's get you located we want to keep you. We want you to be happy. So if you're going to end up leaving the company because, you don't want to stay in Klamath, like that's not what we want. We want you to do well somewhere. So then they found a spot for me. Doctor was leaving, and then they gave me priority to take over this like really good office here. And since then, I've been able to, this office has more potential because there's more specialties here. I'm able to do more complicated procedures. And since then, I feel like I've just gotten like more and more opportunities.
Amazing. There's a lot to also unwrap there. I think you mentioned a big key word, which I don't think a lot of people understand this. I can come and go as I please type of idea. Mm-hmm. There is no length of, now this is where we start talking about it a little bit legally. There is no length of term to your stay at Aspen Dental, meaning that you can, if you feel like it's not the right company and you feel like this isn't the right environment for you, you could technically work with the competition across the street the following day. Do you have any information on that and kind of a little bit more detail, or do you want me to cover that a little?
Well, I was just gonna say, I just really have always liked that they've always been really transparent with me. Like, if this isn't for you, like, don't stay. and I tell that to people, like, when I'm training doctors, I'm like, listen, like, you're going through the training. If it's not for you, like, don't ever feel like you have to stay. Even if you feel like you just want to give it a year to see what it's like, after that year, reassess where you're at in your career. And, what if you end up wanting to be like a really high-end cosmetic dentist and you leave for that? Like, Aspen respects that, and they're like, well, thanks for your time, I'm sorry it didn't work out, go pursue what you're looking for.
Yeah, I mean, no length of term, and no non-compete, which means that we're not going to, that's a big private practice, and there are some other DSOs that put that in place with fear of them taking patients. That's not how we operate, and the reason why we're so confident to offer those types of things is because of our culture. So, Dr. Alpert, why don't you talk about culture, and then we're going to talk about the recruitment process, but talk a little bit about your experience with having fun with either your office or with networking and other people.
Yeah, I was gonna say, because Aspen, I feel like, well, Klamath was a little different. So if you get placed in the middle of nowhere, it's a lot harder for them because there's like not as many things. They try, like they'll fly you out to all the events. It's all paid for, like the trips to like Chicago. Like I'm going on that one trip, I feel like in 2 weeks, to Chicago with all of the other doctors to like hang out, meet them. They always have like CEs for you to learn from. I mean, with COVID, it's been a little bit different. But now, and then here where I'm working, the doctor owns, I think it's like 6 or 7 offices, Dr. Sagar. So then, we have things where we get our offices together. And, they want us to have fun. They want us to get along. And they also want us to like collaborate ideas with each other.
That's awesome. Yeah, and we can go into many details fun that we have at some of these Chicago events, and some of the in-person CEs where they really kind of turn it into a beautiful spectacle. That's the nicest way to say it. Also, as well, I wanted to talk specifically about the CE side of it. What sort of CE have you done, and what sort of opportunities do you have for CE?
Yeah, so here's like one of the things, they don't have every single CE, because sometimes people think that, and I'm like, they don't have every single one. Like, I wanted to learn how to do Botox and fillers, so I went and got that on my own. I wanted to learn how to do like deeper sedation. I did that on my own. But then
did Dr. Sagar, sorry to interrupt you again, did Dr. Sagar help you with any sort of that, or did said good luck with
no, that was me. And you know, and like they pay well. So I was like, I can't complain, you know, they really do pay well. So at that point, it's up to you. You know, you're getting paid really well, and then you're using that money to get these opportunities, and then they bring in more revenue. But then they did pay for, like they're paying for my next implant course. So learning how to place implants, and they do like a bunch of just little ones online as well. And then like they do there's a really big implant one that's online as well. Like, so there's an in-person and online one, and these are really expensive courses. Like they're thousands of dollars worth of CE courses. So that's why I don't complain when they don't pay for every single one. I'm like, okay, you paid for like $6,000 worth. Like I can pay another $3,000 worth for these next couple of years.
Okay, so you saw the value in it, and you decided, you know what, I'm gonna jump on that opportunity. Well, okay. So we have about 6 minutes left. I wanted to focus on this final question, so I appreciate this question. Can you please explain the application / recruitment process? How do we join the Aspen team? Also, family in the certain areas, how's it possible to find a job? I'll take care of that part, but why don't you talk about like your experience regarding the recruitment process? You know, when we met each other and when we started hanging out and when you decide all that fun stuff that everybody wants to know about.
I was gonna say for the recruitment, I mean, Derek's like your go-to person with all your questions, and then you're partnered with, is it Nathan?
It's with Nathan, yeah. So we all have like our particular areas. So depending on where you're interested in, we have other representatives. But yes, you're right.
Yeah, so there's a recruiter for like where you're trying to go to, and then they reach out to you and ask you like a million questions to try and figure out where to place you. And then they can reach out to the doctors there, and then you can get it connected to them and figure out, you know, if you really think it'll be a good fit, they can always like fly you out, have you shadow. But that's when things are a lot more serious. Like you're really thinking about it. It's less just like, oh, you know, like let me see. It's like, I'm thinking of moving here for you to work for you. So they're willing to put in that investment to like fly you out there, have you see what it's like. And for me, I feel like you guys almost over offered. You were like, do you want to go? And I'm like, no, it's okay. Like I've seen the pictures. I believe you. But yeah, they're always willing to go like above and beyond to make sure that you know what you're getting yourself involved with. And if I ever have questions about like the contract, which is not really a contract, it's just like an agreement, there's like a whole team that will explain any single part of it to you, or like how the payment works, or insurance.
I mean, we have a licensing team. We have all these different teams. So
yeah, so lots of people.
So why do you think we asked you all these questions? It's now that you are in the spot that you are.
What do you mean?
So when you said, you know, they asked me a whole ton of questions about everything.
Oh, yeah. I mean, they just want to make sure that you know where you're going and that you feel like they're listening to you. Because to me, I asked, I was like, hey, like, I'm willing to go to a rural area if it means getting a better job and getting paid better long term. But I was like, please put me within an airport that's an hour, like no farther than an hour and a half. So when I got into Klamath Falls, I was like, I can't even complain. Like, this is what I asked for. Like, the airport's an hour and a half, and I could get to anywhere in California. So like a lot of weekend trips. But yeah, I always felt like they listened to everything. And then when I put in my next request, which was like, I need to be within an 30 minutes of the city of Portland, or like in Southern California, you know, they listened to me. I'm like 20 minutes away from the city. I'm in a busy office. So the busier the office, usually the more potential for revenue. So they've always been listening to me.
Tons of questions, and I know there's probably a lot to unpack for everybody that's listening, and I think we're going to leave it at that, which I regarding the process, the first thing, especially if you're very highly motivated, is to reach out to me. I'm going to be sending you a thank you email tomorrow with more information in my contact. Additionally, the process has already begun, right? Do you remember when you officially said, all right, I'm going to commit to Aspen Dental? It was like November, December, right?
I feel like it was December. Yeah. When I was, yeah. Well, as soon as you realize like you want to go into general dentistry, that's a big step right there. Like realizing you're not going into specialty, and then researching all the different companies and figuring out which one works for you. And then after that, it's better to make a decision earlier rather than later, just because positions get taken.
Ding, ding, ding.
Yeah.
Yeah, I mean, I think that's the biggest thing is there's a lot of people that are interested and a lot of people that are looking. And what we do is we keep that seat warm. Once you say, all right, I'm interested, and they say, all right, well, we are forecasting that there will be a need at this office in this area. And then that's where you come in and go through the process. And again, because we ask all these questions to candidates, it's because we want to make sure they're a good fit for the office. They're a good fit. We find the right mentors, anything and everything related to you having a good experience with, you know, on the front end of the entire experience with us. So just remember all that. There's a lot that we can continue to go through, but again, you know, there's a lot to unpack. So first and foremost, I am going to pull this up one final time. I want to thank everybody for coming. Do you have any final words, Doc?
I want to say just find the company that like fits you, because it doesn't really matter, I guess, like where you work. If like that's the culture you're looking for, you know, you'll be happy there. The one thing about Aspen Dental that's a little bit different is the big procedures are extractions. It's just your patient base. So if you like absolutely hate extractions, I just can't imagine enjoying Aspen Dental. But if you love them, I feel like there's nowhere better than Aspen Dental except for like an oral surgeon's office. So like if you really like that oral surgery type of stuff, like I feel like here's like awesome. Like I start off with simple extractions and now I remove tori, big surgeries. But that's the one thing that I think is a little different. So I just wanted to say that.
Yeah, of course. You know, and I think this is also a great opportunity to talk about our patient base, right? Like when we have 950 offices and we're opening 80 to 85 offices per year for the next 5 years, one of the biggest things is we're going to the areas where 155 million American adults that did not go to the dentist. We're trying to find them, and that is your patient base. And the beautiful part is, especially in clinic, and you can tell me if I'm wrong here, those are the kind of the patients that you're already currently seeing when you're in clinic in your third and fourth year as well, right? The ones that are looking for it to be a little bit more cost effective, or they have been neglecting their oral health care for a long time.
Mm-hmm.
Sound right?
Yeah, that's really like our patient base. And that's why I tell people, like, do your research on companies. Like if you're looking for like glitz and glam dentistry, like that's not it.
Yeah. I mean, yeah, we are trying to help the patient. The patient's the most important part. Mm-hmm. Thank you again, Dr. Alpert. You're one of my close friends in the company. I don't think we talk enough. We'll make it work out. But if you have any questions for Dr. Alpert, there's his email address. He is a busy individual, so I always recommend just reaching out to me first. We can always have a chat. There's my contact information. I'll be sending it in email form. But thank you again, everybody, for coming and hanging out with us. I hope we were real enough for you.
And I was gonna, I was just gonna say the thing is, I have people come shadow me all the time. I'm a big training office, so like we train dentists, dental assistants. We have people shadowing as like dental assistants, dentists, hygienists. So I mean, if anyone ever has questions or wants to get in touch with other people that I've shadowed, I'm like very open to it.
Appreciate that, Doc. Mm-hmm. Well, thanks again for everybody. We will be keeping in touch, and I will be hosting a fourth year social once all this madness starts to slow down a little bit. But I appreciate everybody joining us, and have a great night, everyone. See you, Doc. Thanks.